of other drugs. Therefore, this method injection is used. Perhaps this assumption might be correct and very useful for treating the patient. Thank you very much, Dr. Sane. Next speaker is Dr. Kashinath Chavhan, who is a postgraduate scholar from Bombay. He is a professor and head of the department first professor and head of the department at R.A. Poddar College. He is looking after the management of R.A. Poddar Medical College also. He is member of Ayurvedic faculty of Ayurvedic research on both metastases.
Honorable Chairman, organizers, and lovable doctors, I would like to present the case of report of a metastasis in bone, treated with purely Ayurvedic treatment. International Conference in Ayurveda for Cancer, Clinical Study and Research on Bone Metastasis, ASTIA, presented by Professor Kashinath Chavhan, Head of the Department, M.A. Poddar Hospital, R.A. Poddar Medical College, Mumbai, AD. Date 6-7 December 97. As the medium of conversion is English, after translation, the meaning is changed. So we have used Arabic terminology only. In the field of Ayurvedic medicine, nowadays a grave and horrified condition is seen for Karkuruga, cancer, or wound. Even the research and innovation in allopathy have failed to give satisfied result of this disease. It is understood that Ayurveda is 2000 years ancient science. The research made in this field have proved that there is a remedy for this disease, that is a cancer. So, government and non-government faculties should think over this. In such a situation, the all Ayurvedic specialists and research institute will work together on 34 years, religion Hindu, sex female, occupation housewife, treatment period from 23/9/92 to 8/7/93. History. In January 1988, physician noticed a gland in her left breast and started taking treatment, but there was no relief. In July 1988, he was investigated and diagnosed as an Asta in Tata Hospital. After that, patient had undergone surgery and chemotherapy in Hinduja Hospital. In December 91, patient suffered from severe pain in vertebra bone. In February 1992, after cut, there was no relief. And at the end of September 1992, patient come to Poddar. Mahamashati Ghanvati, 50 grams, Ukuta Tattva, Bhasma, 25 grams, Praval Bhasma, 50 grams, Kamkudha, 25 grams, Mukta. Release the patient before treatment and after treatment. Agniman, 3 plus, before treatment, after treatment, good relief. Jvar, good relief. Nidra Nash, before treatment, after treatment, Sankhya Sarani, Lakshan Sarani, good relief. Daurabalya, 3 plus, 4 plus, before treatment, after treatment, good relief. Cortisol, 4 plus, but 1% is not relief. Mandashul, 4 plus, before treatment, after treatment, and still we do not know why they died. Because we have done postmortem with people who have died, which are
still do not know the basic thing why they die. So why they live? Because they live, because of themselves, because of their heart. It can withstand their heart attack. So such people who have lived, people who have survived the heart attack, these 500 people, in the futile hope that they will not get another heart attack because they are single vessel disease, so that they can dilate the narrow coronary artery. They dilated this coronary artery, but they knew their experience of last 15 years. If they dilate the coronary arteries, more than 25 or 30 or 40% of them close down within 6 months. So now they are putting stents. But the stents also are failing. So Mayo Clinic decided that we will put a stent, which we will treat the stent with a genetic material, which will ensure that the clotting will not occur again. So they put the treated stents, specialized stents. Each stent costs more than 3 lakhs of rupees. Such stents they put in these 500 people to see that they may not get the attack again, or they may not get the chest pain again. And they thought they have done that test. And within 6 months, more than 125 of them, that is more than 25% of them, got their stent blocked. And then they wondered what happened. Why? Because they would look in, that's one merit of allopathy that I told you, one merit of American medicine, allopathy, very stringent in discipline. So they wanted to see what was wrong. They said that the doctors were at fault, the stents were at fault, the patients were not doing the discipline after they got the stents. Were they eating meat? Were they smoking? No. These patients were very obedient. They were walking daily, they had given up smoking, they had become vegetarian. What not to tell me, and they had done everything. And everything was done. The doctors were excellent, they were trained, and the stents were superb. Even then, this happened. So they looked in, what happened to these 125 of them? And when they looked into the details of it, you'll be surprised what they found. They found that the hostility score in these 125 individuals was as bad as it was before the operation. That means they were still hostile in their temperament. Hostility, you have to understand. Now, one wondered how hostility can close down these stents. So the pathologist was there in the conference. So pathologists showed that 20 chemical changes occur because of hostility, and these chemicals can close down these stents. So now how can you treat hostility? That was the problem of allopathy. Have we found out any means to treat hostility? No. Does arbitrate or any amount of operation can treat hostility? No. So hostility will have to be dealt with if you bring in the patient's consciousness, as I told you, and explain to him that what is, first of all, the patient who is hostile even doesn't know that he is hostile. How is he going to cure his hostility? And what are the methods of treating hostility? That is our subject, and that's what we are doing for the last 7 years, brothers. In India we have found from 5:30 to 7 on Tuesdays and Friday. Today is the day, Friday and Tuesday. From 5:30 to 7 we meet 150 of them regularly. And we teach them simple exercises by which they come in contact with their real self. I like to talk about this in a very simple manner. So the first book, the primer of which was the village, I just concentrated on the program. Then the second book was on diet. What is the diet? Diet, as it was said, is so important. But when you tell people to change their diet, you have to explain to them why to change. And diet is such an important part of the life that people like to enjoy their diet. So if you tell them that you don't eat this, don't eat that, that doesn't happen. You have to tell them that you can eat everything. And you can enjoy everything and still lose weight. How to do that? Everywhere meditation helps. Meditation is what? To me, simply meditation means doing everything with perfect attention. That is meditation. ध्यान से चलो, ध्यान से बात करो, ध्यान से सोचो, ध्यान से करो, That is all meditation is about. And once you meditate, when you are eating, if you know that what you are eating, and if you remember your past experience of eating what I would like you to do for 2 months, you think this way, that you are fortunate enough in this lifetime that you are able to help other people. And you will be thankful to God that you have been given this opportunity to help them. So you would thank the other people whom you are helping rather than telling me that you are helping doing and you are doing this and that and all what. But you are getting the isolation. So that even if you are doing this, so John, there is a very intelligent businessman, he said, he is stuck. He said, he kept on doing the same thing.